السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 28 in maternity and newborn nursing. Today we are going to discuss 5 questions from question number 189 up to question number 193. معكم محمد ثمان يحيى. نبدأ مباشرة. Question number 189. The nurse is monitoring a client who is receiving oxytocin to induce labor. Which assessment finding should cause the nurse to immediately discontinue oxytocin infusion? The options are number A, fatigue, number B, drowsiness, number C, uterine hyperstimulation, number D, early deceleration of the fetal heart rate. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number C. اللي اخترنا الخيار الخمسين نشوف rational. Oxytocin stimulates uterine contractions and is pharmacological method to induce labor. Oxytocin infusion must be stopped when any sign of uterine hyperstimulation, late deceleration, or other adverse effect has occurred. So the correct option is option number C, uterine hyperstimulation. Drowsiness and fatigue may be caused by the labor experience. Early deceleration of the fetal heart rate are reassuring signs and do not indicate fetal distress. Question number 190. A pregnant client is receiving magnesium sulfate for the management of preeclampsia. The nurse determined that the client is experiencing toxicity from the medication. If which findings are noted on assessment? The options are number A, proteinuria of 3 cross, number B, respirations of 10 breaths per minute, number C, presence of deep tendon reflex, number D, serum magnesium level of 4 milliequivalent per liter or 2 millimole per liter. وقف الفيديو هنا واختار الخيار اللي بشي وسع. The correct option is option number B, respiration of 10 breaths per minute. اللي اخترنا الخيار رقم B نشوف rational. Sign of magnesium sulfate toxicity include respiratory depression, loss of deep tendon reflexes, and sudden decline in fetal heart rate and maternal heart rate and blood pressure, in addition to low urine output. So the correct option is option number B, because respiratory rate below 12 breaths per minute is a sign of toxicity. Proteinuria of 3 cross is an unexpected finding in a client with preeclampsia. And presence of deep tendon reflex is normal and expected finding also. Therapeutic serum level of magnesium are 4 to 7.5 milliequivalent per liter, so the result is normal. Question number 191. The nurse asked a nursing student to describe the procedures for administering erythromycin ointment to the eyes of the newborn. Which student statement indicates that further teaching is needed about administration of the eye medication? The options are number A, I will flush the eyes after installing the ointment. Number B, I will clean the newborn eyes before installing ointment. Number C, I need to administer the eye ointment within 1 hour after delivery. Number D, I will instill the eye ointment into each of the newborn's conjunctival sac. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. Note the strategic word further teaching is needed. This word indicate a negative event query and ask you to select option that is incorrect related to the administration of erythromycin ointment to the eye of the newborn. So the correct option is option number A. I will flush the eye after instilling the ointment. This is incorrect statement. اللي اخترنا الخيار رقم A نشوف rational. Eye prophylaxis protects the newborn against Neisseria gonorrhea and chlamydia trachomatis. The eyes are not flushed after installation of the medication because the flush will wash away the administered medication. So the correct option is option number A. I will flush the eyes after installing the ointment. Option number B and C and D are correct statements regarding the procedure for administering eye medication to the newborn. Question number 192. A client in preterm labor, 31 weeks, who is dilated to 4 centimeters, has been started on magnesium sulfate and contraction have stopped. If the client's labor can be inhibited for the next 48 hours, the nurse anticipates a prescription for which medication? The options are number A, nalbuphine, number B, betamethasone, number C, rhody immunoglobulin, number D, dinoprostone vaginal insert. وقف الفيديو هنا واختار الخيار المشهور. The correct option is option number B, betamethasone. اللي اخترنا الخيار رقم B نشوف rational. Betamethasone is a steroid medication and is given to increase the production of surfactant to stimulate fetal lung maturation. It is administered to clients in preterm labor at 28 to 32 weeks of gestation if the labor can be inhibited for 48 hours. So the correct option is option number B, betamethasone. Nalbuphine is an opioid analgesic, and rhody immunoglobulin is given to Rh negative client to prevent sensitization. And dinoprostone vaginal insert is a prostaglandin given to soften the cervix and to stimulate uterine contraction. Question number 193. Methylorgonovine is prescribed for a woman to treat postpartum hemorrhage. Before administration of methylorgonovine, what is the priority assessment? The options are number A, uterine tone, number B, blood pressure, number C, amount of lochia, number D, deep tendon reflex. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number B, blood pressure. اللي اخترنا الخيار رقم B نشوف rational. Methylorgonovine is used to prevent or control postpartum hemorrhage by contracting the uterus. It causes continuous uterine contraction and may elevate the blood pressure. A priority assessment before the administration of this medication, methylorgonovine, is to check the blood pressure. So the correct option is option number B, blood pressure. Although option number A, C, and D may be component of the postpartum assessment, but blood pressure is related specifically to the administration of this medication. So the correct option is option number B. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.